Good afternoon, everyone. I hope you can see me, right? This is quite high. My name is Esther Peelen. I work at INTEROP as an international advisor. INTEROP is the competence center for digital information management in healthcare in the Netherlands. Thank you. So I put together a couple of slides to give you an overview of the extended EEHR work package 7.2 team. And we are working with a number of experts on the medical imaging studies and related reports specifications. Next slide, please. Oh, okay. So also for our team, the EEHRxF network guideline is really the basis, the starting point. And this guideline was released not so long ago. So it's quite a new use case worked out within the EU, together with a lot of experts. The first release was in 2023. And recently there was a new version released or published November 24. It has just some minor updates because there was also an exercise being done within the EEHRxF network subgroups to make sure that all the 5 guidelines, so for the 5 or 6 categories, like patient summary, e-prescription, medical test results, medical imaging, and discharge reports, are really consistent among each other, because we found there were some inconsistencies between the guidelines, and we tried to fix that. As Hinek already pointed out, the guidelines are a high-level document. It describes the purpose, why are we doing it, why is it important to be able to exchange images and their related reports. Because, of course, we want to support the healthcare professionals and the citizens providing the best possible care. And in many healthcare situations, it's really important to have the medical images available at the time they are needed. So also there are some semantic considerations. So there is a data set provided in the guideline. There's also technical considerations and some recommendations for standards to be used. And it's, like Hinet already said before, they are recommendations. So they are not mandatory, but it points us in the direction of using, for example, DICOM or IHG profiles or FHIR. So how does the extended EEHR imaging team look like? Maybe you are all aware, but the project is a joint action, which means that the representatives from Ministry of Health of the European countries are participating. So it's a bit different than maybe from some other projects where you can have the industry directly involved, the SDOs directly involved. This is not the case in extended EEHR, and it's also kind of a challenge, I would say, because we need the stakeholders there. So we are trying to figure out how to engage them, but I will come to that later. So the team is led from Netherlands together with Cyprus. And we have representatives from roughly 15 countries. So I think we have a good, broad perspective from all over Europe in our team. And we also decided that we will work in sub-teams because some people have different expertise than others. So there is, for example, a team working on the more the functional side and the business requirements. And other people working in a team more on the FHIR specs, for instance. And currently we have, I think, 4 sub-teams. We week weekly. So all the sub-teams report back in the bi-weekly team meeting to report their progress or questions they might have or concerns, so we can discuss all together. And I think, yeah, it works very well. I already mentioned that the team has not necessarily every expert to the table that we would need. So we are very much looking into cooperation with other existing initiatives. And on the left side, you see the My Health at EU working groups. That's also good for you to know that the specifications for the My Health at EU exchange of imaging for all the 3 use cases, the new ones, are still in development. So we are really moving at different forums. And of course, the specifications for EHR systems need to be, as much the same to the ones that are developed in the European infrastructure. So we are teaming, we are acting like a big team, but serving different purposes. So on the bottom, you see a number of projects. So there is UCAIM, EXPANDH, and XGR that are also working in the field of imaging, each from their own perspective. UCAIM is, for instance, creating AI tools, so it's more on the secondary use part. We are not heavily involved, but we know from each other's existence, and once in a while we meet and see if we are in line or if there's something we should discuss or explore more. And that's really nice that the contact has been established. EXPANDH is a project that has recently ended. But within that project, there were a lot of XNets and XBubbles and maybe some other X's I forget to mention. But one of an important asset that came out of that project, at least for our team, is that there was set up a community of doers, also in the imaging field. And at the closing meeting of EXPANDH, there was also the coordination from Extended EHR, and there has been a handover kind of agreement. So I'm now in contact with that group to see if the community of doers can leverage also the work that we are doing now in the imaging team in Extended EHR. The same for XGR. We try to keep up and update each other on the developments. On the right side, you see more the SDO connections that we have established. On top, you see the IHE Europe multi-country working group. This group has been existing, I think, 2 or 3 years, and is looking into real-life implementations. So there are multiple countries participating, not only from Europe, but also other countries like Canada, and I think Saudi, if I'm not mistaken. And this team has written a couple of recommendations coming real from practice. So we were really happy to embed them, these recommendations into the specs wherever they are relevant. We are now teaming up also with the HL7 fire community to really make the fire report for imaging. And the same for IHE radiology, where we happen to learn that there is a team working on an imaging diagnostic report, the IDR. And they are based most in the US, but we had a talk last year in June during one of the IHE Europe Connectathons, and we also expressed the will that we will work together. And from now on, this February, we are really ready to start. Oh, that's one. So what can you expect from the requirements? And that's the assignment that we have as a project. So every EHR implementation guide has an introduction, a methodology description, contains the business requirements, quite recently we were asked by the Commission to also place the references to the corresponding EEHRxF texts. So that's an exercise we are just starting. There's a logical information model that was just explained by Hinek very well. And there's a technical specifications part for how we think the imaging studies will be transferred between countries or even within a country, and the fire IG. So these are the elements that you can expect to be delivered. I'm not going into the logical information model because that was already demonstrated, but we are now finalizing the one for imaging as well. Regarding the timeline, being early 25, we will use the common months to really draft the pre-final specifications, conforming to the format, so the European Electronic Health Record Exchange format, including all these elements I just mentioned. So the model, the technical specs, the fire implementation guide. And then this will go into a public consultation, but as Andreas pointed out, it's a targeted consultation. And we are looking within our national countries, who are we going to ask to provide feedback? And consultation will also be done on the European level, like MedTech Europe, COSIR, all these parties, CPME, will also be involved in this consultation. And then for the imaging part, we need to deliver it in December, and the project ends March 26, so then all the deliverables will be available also for the public. That was the end of my presentation. Thank you.